My name is Jasmine McCorvey, and I will be presenting to you today 4 ways to get more sleep as a parent. I know that you are already tuned in because sleep is like money, and the more sleep that you get, the more rested that you will be. Now, I know that I had to do something to get your undivided attention. Gotcha. Now that I have your undivided attention, I would like to present you crucial and important education on sudden infant death syndrome, better known as SIDS or crib death. This is very important because it concerns your baby's safety and getting all the rest they need to keep growing and remain safe while doing so. Sudden infant death syndrome is the unexplained death, usually during sleep, of a healthy baby that is less than a year old. I know you probably don't want to talk about your baby potentially dying, but this information is very, very, very important. Not all parents are informed about this life-threatening silent killer of newborns and infants. This is very real and should not be taken lightly. Today, if you haven't by now, will receive valuable information that will help you practice better sleep or help you make the necessary changes in your baby's sleep practices. I just want you to take a moment and think about if you were educated properly or even at all about SIDS. The cause of SIDS is actually unknown. I know, surprising, but we still have yet to identify the reasoning behind why babies are dying from SIDS. They have shown risk factors that may relate to SIDS, but nothing is definitive. They have just shown common factors that babies who die of SIDS have in common. There are no warning signs of SIDS, that SIDS is about to happen. It just happened. Some risk factors associated with SIDS include mothers younger than 20 years old, poor prenatal care, premature or low birth weight, co-sleeping, exposure to cigarette smoking, prenatal exposure to drugs, alcohol, or cigarette smoke, brain defects and respiratory infections of the neonate, sleeping on the stomach or side, sleeping on a soft surface, overheating, a family history of SIDS, sex, the baby's sex, mostly boys are at an increased risk for SIDS, the race, there's an increased risk for non-whites, and age, specifically between the age of 2 and 4 months. So I want you to just take a moment and think about those risk factors that I just named. If you need to go back and take a listen to the risk factors that I read out, make sure you do so. But if you have more than 5 to 6 of these risk factors, you're at a higher risk than the average person for your baby to die of SIDS, or at an increased risk of your baby to die of SIDS. So we want to pay special attention and making sure that we are doing these preventive measures that I am about to actually talk about. So how can SIDS be prevented? SIDS can be prevented by breastfeeding and ensuring that your baby is on his or her back during naps and sleep. Keep the crib as bare as possible. There are no need for any bumper pads or anything like that. That just increases the risk of those things getting loose and suffocating the baby. Not overheating your baby with covers. Maybe trying a sleep sack will help prevent this and reduce the amount of covers that are needed. Have your baby sleep in your room, not your bed though. We want to make sure that they're in their own space and that they're in their own little bed, even inside of your room. Don't use monitors that say they help to reduce the incidence of SIDS. Giving a pacifier, if you are breastfeeding though, you want to start doing that about 3 to 4 weeks old. And immunizing your baby has shown benefits, and it has shown to reduce the risk of SIDS. I have included some visuals if you are a visual learner that may help you to fully understand the do's and don'ts of reducing the risk of SIDS in your baby. On the left side, you'll see the yeses. On the right side, you'll see the no's. So we want to sleep on our back. We want baby to sleep on their back. We don't want them to sleep on their belly. We want the crib to be bare. We want a firm sleep surface. We don't want a soft sleep surface at all. We don't want any co-sleeping, no toys, crib bumpers, or loose bedding in the bed. We don't want drop side cribs. We don't want hot bedrooms. So we want to keep that bedroom between 68 and 72 degrees. We don't want to do any smoking or have any mist or anything going by the baby. We don't want any cribs near cords or strings that the baby can pull on. We do, however, want to increase the amount of use of breastfeeding if we possibly can. I know you are a mom and you are, still having, if you have additional kids or anything like that you're having to take care of, working, school, anything, your life still goes on with the addition of your little one. As well as pacifiers. But again, as I stated in the previous video or slideshow, you do want to wait until they have latched on really well, and usually about 3 to 4 weeks after they're born or breastfeeding has been initiated. Lastly, you do want a JPMA certified crib or bassinet. Lastly, the additional picture that we were talking about, if you were in the hospital, you would have seen possibly your baby in a onesie, and it says, this side up when asleep. And if you flip them over to their tummy and had them on their tummy, on the back it says, stop, turn me over. It's just helping to go ahead and get your brain working and allow you to get in a routine of flipping your baby over onto their back when they're asleep, or even when they're just relaxing or anything of that nature, because we don't want them to sleep on their stomach, and we want them to sleep on their back as much as possible until we do that tummy time. In the event that your baby does fall asleep during tummy time, you want to go ahead and flip them over to their back, also known as the supine position. I know they may be sleeping so cute and you don't want to wake them and they just fell asleep, but their safety ultimately comes first. You want to try and do tummy time for 3 to 5 minutes at a time, 3 to 5 times a day as a newborn, and increase these periods as they progress in age. Tummy time is going to help develop muscles for crawling, helps with any stomach issues such as gas and constipation, strengthens arms for reaching and grabbing, formation of hand arches for fine motor skill development. It strengthens the back to help with posture. It improves head control. It strengthens those neck muscles, helps with depth perception, cognitive development, and prevention of a flat head, also known as plagiocephaly. In this picture, it is just enforcing and showing and allowing you to see the benefit of tummy time. I want to thank you for taking the time out to watch my video and to gain some education, even if it's reinforcement of education of things that you already know or things that you didn't know that now that you know. I'm glad that you have increased your knowledge, and I have attached a link for a quiz that is very fun to do, and it makes noises and all of those good things just to help to make sure that you are understanding this content.